I've always kind of had a feeling that I was different. From early stages, my mom already immediately saw that I was already having problems. I was bleeding almost every single day, and I would also be having fevers every single day. But the doctors would just tell her that, oh, it's just like a phase, like she'll just grow out of it. Over time, she still saw no improvement at all, and she just saw things getting worse. That's when she decided to just get a second opinion. They ran a bunch of tests, and with the genetic test, they saw that I indeed had APDS. I was diagnosed when I was around 3 or 4. It wasn't until when I was like in elementary school when I actually started noticing it. I would have like easily 7, 8 doctor's appointments per month. Well, other kids got to do normal childhood experiences, like they could go to the park, play in the playground, go to school every day, have time to spend with their friends and family. I would just spend my time being stuck in a hospital room. And that's not even counting the times that I was like really sick, because I feel like out of all the things that I most struggle with is infections. I would easily be getting like at least 1-2 infections every year. While my APDS diagnosis was the start of something, the journey was far from over. I was willing to try anything if it meant for a healthier life. Within a few months of starting Joenja, my parents and my doctor started noticing some signs of improvement. It felt like a new chapter in my life, which led to controlling my symptoms a lot better, and it also led to less hospital visits as well as less doctor's appointments. When you have APDS, you're afraid that at any moment you could be fine, but then out of nowhere, something bad happens and you wound up in the hospital again. There wasn't a specific treatment or medication that was specifically used to treat APDS, but since taking Joenja, this sense of uncertainty just started fading, and now I have at least a more clear sense that now I'm gonna be able to do all the things that I've always wanted to do. One of my biggest milestones that I'm definitely proud of is that I'm finally graduated from high school, and now I get to start a new beginning by going off to college this fall. I'm excited to start this chapter in my life, and I'm very excited to be able to follow my dreams and become the person I've always known I can be.
Approved use. Joenja, leniolisib, is a prescription medicine that is used to treat activated phosphoinositide 3-kinase delta, PI3K delta syndrome, APDS, in adults and children 12 years of age and older. Important safety information. Tell your healthcare provider if you are pregnant or plan to become pregnant. Joenja may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start receiving Joenja. Use effective birth control to prevent pregnancy while taking Joenja, and for 1 week after you stop taking Joenja. If you plan to become pregnant, continue taking your birth control for 1 week after stopping Joenja. Talk to your doctor about what type of birth control method is right for you while taking Joenja. It is not known if Joenja passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take Joenja. Tell your healthcare provider and pharmacist about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Joenja and certain other medicines may affect each other. Tell your healthcare provider if you are scheduled to receive an immunization, vaccine. Joenja may affect how well a vaccine works. Discontinue Joenja and seek immediate medical attention if you develop any signs and symptoms of serious allergic reactions, including itching, skin redness, hives, rash, difficulty breathing, or swallowing. The most common side effects of Joenja include headache, inflammation of sinuses, weight gain, and dry, itchy, and inflamed skin, eczema. These are not all the possible side effects of Joenja. Tell your healthcare provider about any side effect that bothers you or does not go away. You can also report negative side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. or Farming Medical Affairs at 800-930-5221. For more information, please see the full prescribing information.